All right. Well, thank you everyone for joining for this month's frequently asked question session. And I am Laura Santner, and I'm a therapist here at SkinPick.com. And I've been working with BFRBs a really long time. So I'm looking forward to answering some of your questions the best that I can. I'm going to go over the pre-submitted questions first and the frequently asked questions. I'm also actually going to go over today some women's specific questions for Women's History Month. So I thought that might be a special edition for March. So if you have any women's specific questions as well, please type them in the Q&A chat box. So this is going to be pretty casual, and we're going to go for about an hour and just sit back, relax, have some water, have a fidget next to you. I'm all into fidgets. So here's the fidget that I have next to me, my fidget of the week. This is a really old fidget, and I'm surprised it has not fallen apart yet, but it's got these little balls inside, and it kind of crunches. So really like that fidget. So have your fidget ready. And let me go over some of the questions. Okay, so a common question is, what causes skin picking? So the cause is kind of complex and not entirely known, unfortunately, but so far research indicates that there is an inherited predisposition, so genetics, but there are other factors in addition to that. So just because you have an inherited predisposition does not mean you are going to wind up picking your skin. So other factors could include like hormones, temperament, age of onset, co-occurring disorders, right? And of course, environmental stress factors. Okay. So again, so skin picking is caused by a variety of things. And it's like this combination. Just because you have, one thing is going on does not mean you're going to wind up having a skin picking disorder. Okay. And I hope that answers that question. What kind of therapist do I look for is another really commonly asked question. So you want to look for a therapist that's trained in BFRBs, that's knowledgeable and skilled with working with BFRBs. Okay, so you can find therapists that are trained. You can find them on skinpick.com. You can find them on bfrb.org. And now you can also find them on iocdf.org. If you choose to join the SkinPick program, all of the therapists on the program are skilled and trained and knowledgeable and supportive and wonderful. Okay, so just putting that out there as well. When you are looking for a therapist, besides the importance of connecting to them and liking them, because that is important, you do also want to make sure that they are familiar with the different kinds of treatment modalities. So that includes the comprehensive behavioral model, also called COMB, acceptance and commitment therapy, or ACT, habit reversal training, HRT, cognitive behavioral therapy, CBT, dialectical behavioral therapy, DBT. Those are kind of like the main ones that you want to make sure that your therapist uses, and not just one of them. So if your therapist says, I work with CBT, no, you want them to work with all of them. Okay, because it's not just one modality that's going to work, it's a combination. Okay. And again, I'm going to answer your live questions afterwards. So I'm just checking. Good. Yes, I'm seeing some questions starting to come in. Great. Okay. So going back to some commonly asked questions and pre-submitted questions. How common is skin picking? So according to the DSM, the 5th edition, 1.4% of the population has dermatillomania. However, More recent findings suggest that it's quite higher than that. So maybe it's more like between 2 and 3% of the population. So I like to explain it as it's about 1 in 20 people. Okay, so it's a little bit tough to determine, the exact number, how common skin picking is, because there's so much shame and embarrassment, right? So people don't, it goes underreported. So my guess is it might even be higher than 2 to 3%, which is already quite high. So it is quite common. You are not alone, even though it feels like that. People are, we are experts at hiding it. Is dermatillomania a lifelong struggle, or is it possible to stop? Yeah. So skin picking is a chronic disorder. So what that means is there is no cure. So yes, a part of it is going to be with you lifelong. That said, it doesn't mean that it's always going to be like activated, and it's not always going to interfere with your life, right? So, yes, you can come to a point where you can feel confident and you can manage it, or urges will be really low and insignificant. So, what can be really helpful in this process is to have lots of self-compassion, right? Slips happen. It's part of the process. You keep practicing all of those tools, all of those strategies, and that will help you to better manage the urges and will help. And the more consistent you are, um, the easier it becomes, the lower intensity of those urges become. Okay, so just remember, progress is not linear. Okay. Okay. Are there any skin treatments available to remove evidence of my picking? So scars left from picking, right, they can range from minor to severe. So some can go away in a couple of weeks, and more serious ones might take a lot longer, like 6 to 18 months, let's say. So they can take a little bit longer if there have been any kinds of infections or any kind of skin tissue damage. Um, so that so things like that can complicate it a little bit more. But in general, what can you do? So if you're not actively picking and you've allowed some space for it to heal, give it time. Again, patience and self-compassion. But if it's bothering you and it's time and you want a little bit extra help, talk to a dermatologist. There are options. There are different kinds of creams and ointments, different things with like silicone pads. A more extreme treatment could be like laser or skin grafting, depending on the skin condition and your needs. So it really varies, depending on what's going on with you. But there are options. But I do recommend waiting to seek treatment from a dermatologist until you've can manage some of the urges, and are feeling more confident with managing your urges. Okay. Oh, yeah. Are there medications, right, to help manage these urges? Such a common question. So, unfortunately, no. There are no FDA approved medications for treating a skin picking disorder. Excuse me. That said, right now, the most researched and most commonly used is a supplement. So it's not a medication, it's an amino acid over the counter supplement called NAC, N-acetylcysteine. So right now, that's the one that's most recommended if you are looking to try something. Again, it's a supplement, not a medication, but it is the most researched and most commonly used. The brand, I get this question a lot. The brand that they used for research was the brand Swanson. So I tend to recommend the brand Swanson, or I'm familiar with the brand Now, and I like that brand. So in terms of brands, I would recommend Swanson and Now. And all brands can have slightly different effects. So if you're decide you want to try NAC, and it's not working for you, try a different brand. Or if there are very little to no side effects, but if you experience a side effect, change brands and see what happens. The dosaging for NAC also varies. The starting dose is 1,200 milligrams, and they recommend you breaking it up. So 600 milligram tablets. They studied up to 2,400 milligrams, so you can go up to 2,400. And break it up throughout the day, especially if it's before a time when you tend to have more urges. NAC tends to be short lasting, so some people feel an effect from like 3 to 5 hours after, and some people more like 8 to 10 hours. So if you get like really stressed in the morning and you want to kind of have something to help you for the day, take something in the morning, and then in the evenings tend to be a harder time, take another dose in the evening. Okay. Another potential medication, it's an up and coming medication, and it's called memantine, and it definitely needs some more research to be done, but it's got a lot of potential. It's actually an Alzheimer's medication, but it targets the glutamate receptors the same as NAC. So that's why there's some promise there. And the dose, I don't know about brands. The dose with that right now, the starting dose is 10 milligrams a day, and it can be increased up to, as far as I know, 20 milligrams a day. Okay. What are some common triggers, and what can I do to manage urges? Yeah, so there are a lot of potential triggers, as I'm sure you're already aware of and have experienced. So I like to recommend doing some tracking, some self-monitoring, just so you can learn about your specific triggers. Okay. Typically, triggers happen when you're overstimulated or understimulated. So times when you're feeling like really overwhelmed, for example, like stressed and anxious, that's overstimulated. Understimulated is when you're bored, right? And you need some more stimulation. And so urges happen when your body is trying to regain that balance. Okay. So triggers, what are some common triggers? So triggers can kind of go in these different categories. I put them in the categories called SCAMP. Sensory, cognitive, affect, motor, and place. Okay, so those are some common categories of triggers. So, for example, sensory, what your skin like looks like and feels like. Cognitive, what are the things that you're thinking? What are you telling yourself? Affect, how you're feeling. Motor, I like to describe as kind of like your body position. And place is where you're located, such as the bathroom, in bed, right? Your favorite spot on the couch. Okay. So depending on your trigger and your situation, that's where you can start to think about different strategies. So for example, like a sensory strategy might be like, your fidget, right? Cognitive strategy would be being aware of what you're telling yourself, practicing rephrasing some of your thoughts, right? Effective strategies are coping with some of your feelings and practicing expressing your feelings, right? So art, writing, music, walking, exercise, right? Those are helpful ways to cope with the effective triggers. Motor strategies, so things that you can do to block yourself, block that movement, such as gloves, tape, band-aids, long sleeves, tights, things like that. And place strategies, what can you do to change your environment? So sitting in a different spot on the couch, working in a different room, okay? or a different place, keeping the lights off, blocking mirrors. So you're making changes to your environment. Okay, so I'm just naming a couple of examples to get you started, but there's lots and lots of things that you can do. Okay. Um, and if you want some more specific things, again, just type in that Q&A box and I will get to them live and we can dig deeper. Excuse me. What is the prevalence between men and women? Is it more of a woman issue? Yeah, so BFRBs are actually equal opportunity behaviors. So they affect both men and women. They are highly underreported, however, and goes undiagnosed. So oftentimes, women have the illusion that they are more susceptible. Excuse me. So it's possible that men are less likely to report having a BFRB than a woman, and it might also feel more socially accepted for a man to have it than a woman. So again, it might not bother them as much, but men and women both can get it equally. So yeah, they are equal. Sorry for my coughing interruption there. Okay. Okay, here are some some women-specific questions that I think are pretty important and common to go over. Do symptoms get worse around the menstrual cycle, right? So yes. So for many women, urges increase in the days leading up to your period. And this can happen because estrogen and progesterone drop. So that can affect your mood regulation, impulse control. It can increase anxiety, irritability, restlessness. You also just might generally feel more uncomfortable, right? So in addition to all of that, your skin changes around menstruation as well. So it might become more oily, or you might experience more breakouts. So that can also increase those sensory triggers that we talked about. So now, not everyone experiences this. So I do suggest tracking. Again, tracking your cycle and just tracking your patterns so you can see what's going on. And if you know your period is coming, you know that week before, prepare, start to plan, think about what strategies you're going to use in advance. Okay. How do hormonal changes across life stages affect urges? Yes. So during puberty, I would say is a very significant time. There's a lot of changes of hormones around puberty. This is also a common time, the most common time that BFRBs start to emerge because of all of these changes of hormones. So during puberty, also there tends to be an increased oil production, right? So teenagers have oily skin and more acne, and again, that leads to more sensory triggers. This is also a time of development when emotion regulation is still developing. So teens are just trying to figure it all out. Right. So it makes it harder to resist those urges. Okay. So it's a tough time. It's a tough time. I would say another life stage for women is pregnancy. And that's another time where there's a lot of hormonal changes, right? So some women might improve with more stable hormones and lifestyle shifts. but others, it might worsen. So there are different kinds of stressors and body changes and anxiety and discomfort. So all of that plays a role. And also during pregnancy, there's limited treatment options, right? So that can make management a little bit harder. Postpartum, right? That's another time that tends to be, that one tends to be a higher risk period for increased picking because there's a sudden hormone drop, like in estrogen and progesterone. So in addition to that, all those intense hormone changes, there's sleep deprivation, there's stress, there's lifestyle changes. So there's an increased risk of anxiety and depression. So all of that combination can, again, make urges higher and make it harder to manage. And then there's menopause and perimenopause, right? So again, the hormonal fluctuations there can increase. So someone might be more likely to experience anxiety, restlessness, discomfort, skin dryness, right? And skin texture changes. So that can happen as well. So I would say overall, hormonal changes and instability of hormones, right, and emotional stress can lead to higher vulnerability to picking. Can hormonal birth control help or worsen picking? So this depends on the individual. And I don't think, there's no like one size fits all answer here. So it may help because it can stabilize that fluctuation in hormones. And it could reduce acne and skin inflammations, which can be really helpful. It could also improve like PMS related mood swings. So that could be really helpful. But it could also worsen symptoms. So it could worsen if it can cause changes in mood, like a mood side effect. So irritability, anxiety, or depression. It could potentially lead to new skin issues or sensitivities. And especially if you're particularly sensitive to like hormonal shifts. So different kinds of birth control can have different effects as well. So sometimes it might take a little bit of like trial and error and adjustments, and definitely working with your doctor who's prescribing you that medication. Okay, I want to take a moment here. Let me see if I can figure this out. Speaking of women, I actually want to ask you guys a question before we go to your live Q&As. Let me, if I can figure this out, let me see if I can ask you guys. I hope you can see this. Yes, so skin picking, beauty standard question. How do beauty standards and pressure to have perfect skin influence my picking? So I'm hoping there's a spot you could write your answer in, if I did this correctly. If not, something to think about and reflect about, or write your answer in the Q&A if I did this wrong. Okay. Yeah, so something to think about. Oh, I think some answers are coming in. I'll give it like another minute. I've just been like reflecting on women for Women History Month. So, okay. Wait one more second, and then I'm going to end the poll. Okay. Let's see what happens if I press. Oh, I pressed share results, but well, oh, wait, let me stop sharing. Wait. Okay, so Let me see. We have not at all. Helps me helps me try to avoid picking. Don't want to have anyone be able to see picked areas on my body. It honestly something sometimes is helpful when I have big events. I stopped picking my fingers around that time. But after that event, we went back to normal. Minimally, people with pimple and scars and scabs are repulsing. Oh, yeah, I read this from people's reactions. Oh, so there's a lot of shame. Yeah, it's futile effort to fix my skin. No one around me has skin issues like mine. The shame. I'm seeing this theme of shame. It doesn't. What is this one? I can't see. I can't read them all. Okay. When I experience breakouts, I perceive myself to be less beautiful. Yeah, I feel sometimes I can pick a lot, but no, there are times to hide my scars so I don't feel bad about it. Yeah. Yeah, so I'm definitely seeing a theme of shame. Yeah, so thank you for answering that. I thought I'd switch it up a little bit and ask you a question. So let me now go to your live questions and see what I can answer. Ooh, there's a good bunch here. How can I reach out for a therapist help for the person who is suffering from skin and hair pulling? So if you want to reach out to a therapist for someone else, you want to kind of ask them again those same questions about what are their treatment modalities? Are they skilled? Are they knowledgeable? But when you're reaching out for someone else, make sure that that other person wants treatment and wants you to reach out for them. Okay. And if you find a therapist that maybe you like or you think would be a good match, you can then pass that therapist information along to the person suffering, and then they can kind of make those final steps and connections. And again, see what they want. Okay. So that would be my recommendation. Need the individual therapy session help to help him out how to contact with them. So again, I'm not sure I fully understand the question, but if go through any of those therapist lists that are in your area and feel free to just talk to them, make phone calls, email them, ask them what their there's also a follow-up question, therapy costs. Ask them what their prices are so you can kind of compare and contrast, see what you can afford, who accepts insurance, and who you're comfortable with. Okay. As far as the program goes, you can, if you're interested, you can email support@skinpick.com and you can ask whatever questions that you have about the program and the cost. The cost, I believe, varies depending on what plan you sign up for and what your financial situation is. Okay, so just email support@skinpick.com if that's an avenue that you want to explore. Okay. Oh, I've been getting this question too a lot lately. So, has there been much research into using GLP-1 drugs for BFRB treatments? So, no, there has not been much research yet. Um, some people are exploring the GLP-1 medications for BFRB. Some people are finding it really helpful, and some are not. So, I don't. There needs to be more research. I don't know if there's been any specific research on this yet. I'll have to look. There might be like a couple of studies here and there, but it definitely needs to be more research. So I wouldn't necessarily recommend that avenue right now, but it could be something to explore in the future. Okay. My son is asking for tool and help, but I don't know who to contact. Yeah, so um, depending on the age of your son, um, you know, um, SkinPick has a parent program, so that might be something that you would want to consider. So that would be the program that you would basically be doing it, but with your son. So both of you together, and you can kind of help him and help him to learn tools, um, and you can find ways that you can best support him and learn. Right, you're both learning at the same time. Okay. So if you're looking specifically for help with at skinpick.com, I would maybe, depending on the age of your son, suggest the parent program. But again, just questions, email support@skinpick.com. Okay. And if you're looking for an outside therapist, again, you would be talking to a therapist, both together, depending on the age of your son. And the therapist will then determine kind of where he's at and what he needs and how the therapist can best support your son and best support you as well. So you can support your son. Okay. Okay. So in order to get started, just send an email. Just send an email, pick up a phone, start looking at um, skinpick.com, IOCDF. .org, BFRB.org. So it's just so you have a list of trained therapists, and start going through them and see who you are comfortable with. Ooh, yeah. Is skin picking disorder similar to body dysmorphic disorder? No. They are different. They're very different. However, sometimes they can overlap, but they don't necessarily have to. Someone with body dysmorphic disorder might also have skin picking, right? And vice versa. But just because you have skin picking, it does not mean you have a body dysmorphic disorder. And just because you have body dysmorphic disorder does not mean you also have skin picking. So, I mean, when when someone is picking, it's not necessarily because they're dissatisfied with their body, right? It could be because of they're trying to regain balance, trying to regulate themselves again. So it might not have anything to do with how they're feeling. About how they're feeling in their skin, in their body, right? Certainly when you're picking and you're feeling upset afterwards, and you're frustrated by what happened or you don't like what it looks like, that's still not necessarily body dysmorphic disorder, right? That's just a reaction after picking, a normal reaction, an expected reaction. So they are different. Okay. I'm struggling to find a support group. Oh, and it's hard to talk about in general mental health support groups. Oh, yeah, like NAMI. Yep. Any recommendations? I'm usually not available during the day. Yeah. So, I mean, skinpick.com has support groups actually. And they have it all different times and days. So that's something to consider. They have great support groups. The skinpick.com also has um, a community page and a community space where you can type in and get involved with other people and support each other in that way. There are also other virtual support groups outside of SkinPick. You can check again on, I think it's still up on bfrb.org. They have a list of support groups in different areas. But if you can't find one in your area, there are other virtual support groups through BFRB Changemakers. They do a support group. Pickingme.org. They do a support group specifically for skin picking. So I would suggest that. I agree. Absolutely. Join a support group that's specific for BFRBs. Yeah. So there are options. They do exist. They're out there and they're really helpful. So I do highly recommend them. It helps to feel not alone, get ideas. It's a great way of getting support. Okay, so again, SkinPick has support groups and community pages, and um, pickingme.org, BFRB Changemakers. Those are some places to find online support. You can also join a group, by the way, like a virtual group from another country, because of maybe the timing would work out better for you. So for example, BFRB UK and Ireland, they also have virtual support groups. So maybe timing for that would work out better for you. Okay. Okay. Yeah, so I answered this question in the beginning. I will repeat it. Is it possible to cure picking, or is it a lifelong management situation? Yeah, so unfortunately, it is a chronic disorder, which means that there is no cure. So yes, it is a lifelong management situation, but that doesn't mean that it's going to be difficult lifelong. Right. So there might be long stretches where you have no urges, or the urges will be very low and won't bother you. Okay. So just because it is lifelong does not mean that it's always going to be active and interfere and affect you lifelong. Okay. Can you talk? Oh, yeah. Can you talk a little bit more about sensory triggers and how to combat them? Yeah. So, I mean, sensory triggers, right, are how your skin looks and feels mostly. So dry skin, flaky skin, any kind of skin conditions can be sensory triggers, right? Blisters, pimples, right? Anything like that. Anything that's like bumpy, even a color, if it's a different color, might be a trigger. So those are kind of other examples of sensory triggers. So to combat them are using different like fidgets, depending on what the sensory is that you're feeling. So you can have like fidgets, like this. I did a whole webinar, look it up. It's one of my favorites on sensory fidgets in particular. So you might want to look into that because there's a lot of good fidgets that I go over. But again, in addition to the fidgets, for sensory stuff in particular, I would also really think about barriers, so ways that you can block yourself. So again, it kind of depends on where on the body you're picking. So like gloves and tape can be really helpful. Band-aids. I really like the pimple patches. Those are really great barriers. And they can come in like fun, like shapes, like and colors and glittery, and there's stars. And what I like about that is it helps to heal the spots, but also acts as a barrier. Again, depending on where on the body and how big the area is, because the pimple patches are just like little small stars. Yeah, so things like that. And wearing clothing that will maybe block you as well. So like long sleeves. In the winter, it's a little bit easier to wear like a turtleneck. So it's harder to like get in if you're like a chest or back or shoulder picker, right? So something that makes it more difficult for you to get to it. Wearing tights can help for leg picking. Again, depending on the weather and if it's too hot, like you want to be comfortable. The most important thing to consider is your comfort. So if you are uncomfortable, it is more likely that you're going to have more urges and they're going to be stronger. So be mindful of like the temperature, right? Are you hot? Are you cold? Are you comfortable in what you're wearing? Make sure you're comfortable, because that plays a really big part in sensory as well. Okay. Yes, getting nails help. Yeah. So for some people, wearing like press on fake nails or just getting your nails done regularly helps a lot. Mm-hmm. It not only helps you feel good, it's a nice distraction. It looks good, and it makes it a little bit, sometimes it makes it harder to pick. Sometimes it helps to pick. So it is something you want to just see if it works for you. But generally, that's a really nice strategy. Thank you for sharing. I have removed any type of tools from the bathroom. Yep, that would that I would use to pick my face. But I just want to substitute the tools with my fingers. Ah, help. Yeah. So I would prefer you use your fingers than the tools. Um, so that's a great step for putting the tools away, hiding them, right? Tools like scissors or tweezers, right? So that's can increase chance of infection. So I definitely recommend trying to avoid using those tools. You can throw them in a mystery drawer so it takes you longer to get to them. You can freeze them in the freezer. Again, so you have to wait for it to thaw out. um, Throw it in a closet so you really have to like dig and look for it in order to use it. So make it difficult for yourself to use those tools. Yeah, and unfortunately, there is no substitute. There is no perfect substitute. Nothing is going to feel the same. So, yes, I would prefer you use your fingers. What I would suggest is maybe before going in the bathroom, make sure you put some lotion on or Vaseline on your fingers. So that makes it a little bit more slippery and harder to use. And again, get those barrier strategies at the ready. Maybe you want to have gloves on when you're in the bathroom. If you're looking in the mirror, maybe you want to cover the mirror. Maybe you want to dim the lights or keep the lights off. So you want to give yourself lots of barriers so that those hands don't start to wander. Okay. I hope that's helpful. If I think of other things, there are lots of things, but that's kind of what comes to my mind at first. So we'll go with that. Um, okay, good. Um, how do I deal with the guilt? Yeah, I face after picking. I don't want to leave my house, be in direct sunlight, or wear makeup, etc. Yeah, that shame and guilt is real, and it's really hard to manage it because you feel bad. You didn't. Part of you wanted to pick because it brings comfort and relaxation and balance, but the other part of you does not, and it is upsetting and it leaves you with marks. Um, and it is frustrating and you want to stop and you want to interrupt it, but once you start, right, you can't because you get in this trance and this cycle, and it feels so good and comforting, but then you feel terrible after. And yeah, it's really hard and it is a cycle. And it's really important to forgive yourself. um, have lots of self-compassion, do extra self-care. So when you're feeling that guilt after picking, see what you can do to treat yourself kindly. Right. So maybe give yourself a massage. Again, maybe put some lotion or do a skincare routine. Drink some water. Do some stretching. Do some meditation. Do something before leaving the house. Okay. Um, Maybe you want to change your clothes so you feel a little bit more comfortable and confident, right? And remind yourself it's okay. I slipped, right? Why did I slip this time? What was going on? Okay, what can I do differently next time? Okay, I'm going to try XYZ next time. Okay, so what am I going to do right now? Okay, I'm going to take a deep breath. I'm going to slow down. It's okay. It's going to heal. I'll be okay. And, it's going to look a lot worse to you than to others, right? Okay, maybe it's not so bad. Let me just give it 5 extra minutes. I'm going to do something else for 5, 10 extra minutes to try to relax and let maybe some of the redness decrease before I go outside. Maybe I'll put some water on your face. Let me refresh myself. And I'm going to wear what I'm comfortable with. So whether or not you decide to wear makeup or not is up to you. Um, comfort is priority, but be gentle with yourself. Okay. Slips are natural, normal. It happens. It's okay. You'll try again next time. Okay. Are there any groups who support progress through the book Overcoming Body Focused Repetitive Behaviors? Yep, it uses the Combe treatment method, but I feel like group meetings would be helpful for this as well. Yeah, so that's a great book. I'm glad that you brought it up. It's like the staple book, Overcoming Body Focused Repetitive Behaviors. Um, I don't think that there are any specific support groups that go by the book. Um, but if you're in treatment for therapy, I mean, that's what a therapist would be doing with you. They would be going through all of those methods that you are reading about in Overcoming Body Focused Repetitive Behaviors. So while there are no support groups with that specific structure, therapy does go through that structure. Um, yeah. So hope that helps. Hope that answers your question. Oh, yeah. Recommended body face soap to keep skin as clear as possible. I do get questions about products, and I don't have any specific product names. Unfortunately, I mean, again, it's kind of like trial and error. Or, if you join any of these forums, like any of the SkinPick community group, or any Facebook forums, that might be a good question to ask, and just to see what are some of the products people are using. I would recommend things that are gentle and fragrance free. And paraben free. So definitely, if you can, fragrance free and paraben free would be my like number one recommendation to be aware of. Anything, natural and organic is always best, because you want to avoid any kind of harsh chemicals. Okay. So that's what I would say. Yeah, hope that helps. Where can we find your talk on sensory fidgets? So, yeah, you can find it on the YouTube channel. It should be on the SkinPick YouTube channel. I think that's the easiest way to find it. I believe you can also, if you go on the website, you might also be able to search past webinars and find it that way. Okay. And if you can't find it, email support@skinpick.com and we'll just email you a link. Okay. Yeah. I use these for picking my fingers, and then there's a link which I can't click on right now. Resistant protection, reusable sculpture. Yeah, I can't click on it right now. Maybe I'll copy and paste it and try to look at it later. But that is great that you found something um, that is helpful for you and that you like. And again, it's just about trying different things and seeing what works and what doesn't work. And even if it doesn't work, keep in mind it just might not work that time, that situation. So it doesn't mean it's not ever going to work. So keep it in your toolbox. Okay. Yes. Oh yeah. So hydrocolloid are great and cheaper. Oh, then pimple patches. Yeah, any kind of patches that have the hydrocolloid in it is great. Yeah, and they are larger, so you can cut them to size if you need. Yep, yep. So in addition to like the smaller star shaped and fun shaped like pimple patches, yeah, any kind of like hydrocolloid patches, that's right. You can cut them to whatever shape you need. So that's a little bit better if you have bigger areas that need to be covered. Yes, they are great. They're a great barrier and also help with healing at the same time. Thank you. What sensory fidget tools can you recommend for people with arthritis? In their hands. My hands get tired with fidget toys, but it's my hands that I pick. Yeah. So again, you're going to want to try to experiment a little bit. So actually I might even recommend like things like this, like a ball, because it's kind of helping with the arthritis at the same time. And it's like a nice stretch. Um, You may or may not like something, like this again, that's kind of helping to strengthen and feel good. Something like that. That might be too much. I really like Theraputty. This is pretty relaxing. This is great. Again, a nice like fidget, but also like helpful for your hands and relaxing and stretching. And like massagers, different kinds of massagers. They have like I think I have that here too. Got this here too. A finger massager. Yeah, I have these little finger massager. These little finger massagers might also be really nice and feel really good, or any kind of massager might be a really good strategy if you have arthritis. So you're kind of keeping your hands moving, but it's also like relaxing and massaging them. Okay. Oh, yep. So another question about the video about sensory fidgets. Yep. So you can find it on our YouTube channel or on the website. And if you cannot find it, just email support@skinpick.com and we will email you a link. Oh, yeah. So someone says picking stones from Amazon help. I have mixed feelings about the picking stones. For some people, they're great. What I don't like about it is I don't like the tool. I don't like that it comes with the tool. So I don't like that it's kind of still that same movement, that same pattern of like picking. So it's almost like encouraging that same movement, except it's not on you, it's on the stone. And then what happens when you're done picking the stone? Like you're more likely to transfer over to your skin. So I have mixed feelings about it. But again, if you find something that works for you, like use it, right? As long as you feel good and you use it, and if it works, it works. So just something to keep in mind. Yes, Facebook has support groups as well. TikTok makes me less alone. Yep. So TikTok, YouTube, right? There are other social media outlets, Instagram, right, that have lots of videos that can help you to feel less alone. In terms of the Facebook support groups, there are some closed ones, some open ones. It's a little bit of a mixed batch. So as long as you're just kind of prepared. So sometimes people find them a little bit overwhelming and a little bit more triggering. Sometimes you get not such helpful feedback, but sometimes you do. So again, just something to explore. But yes, they exist and they're out there. There are lots of outlets. Okay, let me just check. Okay, ooh, we're doing good. We're doing good. When I skin pick, people tell me that I don't have any pimples to pick at, but I disagree. I answer that if I wouldn't have any pimples, I wouldn't pick at all. I feel the need to get rid of pimples, and I have the feeling that it's not just to regulate myself, but it's just me trying to give me an excuse to do it. Um, it is just me trying to give me an excuse to do it. So, pimples are right are a really big sensory trigger. That said, skin naturally has little bumps on it that might not actually be pimples. So sometimes to you, it might feel like there's a pimple, but it might not actually be a pimple. Um, and in addition, the pimple, right? Pimple might be more noticeable to you and you might feel it and other people might not. So just something to keep in mind. If you have a lot of pimples or a lot of bumps and it really bothers you, and if you feel like that is your main trigger, talk to a dermatologist, right? If that is your main source, and if you feel like you wouldn't be picking if you didn't have any of those bumps, talk to a dermatologist and see what treatment options you have to manage those bumps and manage pimples. Because there are options. There are different, again, creams, medications, that you can kind of explore and see what can help with that for your skin. And then you'll see if your skin no longer has those bumps or they're quite managed, like, do you still have urges? Okay, so that would be just something to think about and explore. Okay. Oh, yes. Bio oil and Reversa skin brightening sunscreen helps my scars. Oh, great. Thank you for the recommendation. So that's bio oil and Reversa skin brightening sunscreen creams. Okay, so there's some brands. Someone asked about some brands. There we go. We got some brand recommendations right here. Thank you. How to get your household involved, ooh, in a positive way to help remind you not to pick without shaming. Ooh, yeah, really good question. I mean, so many things. So that is great that you want to share. First of all, share what your experience is like in your household, and let them know what you're struggling with, what it is, what's going on for you, and think about what would be helpful for you. So, for example, someone telling you stop picking, that's not going to help. That's not helpful. That's going to make it worse. It's going to make you feel bad. You're going to feel guilty. So that is not a positive way or a helpful method in reminding you not to pick. But having strategies like fidgets out and about, like in a little bin in trigger locations, such as the couch or your desk next to your bed, right? And making so other people can make sure that that fidget box is there, or that your fidgets are visible and accessible, so they could help you with that. They can, if they see that you're having a hard time, they could ask if they can help you to get a fidget, right? Hey, I see that you're picking right now, or it seems like you're having a hard time. Would you like me to get you a fidget? Or they can start a conversation with you. Hey, I see that it looks like, right, or looks like maybe you're having a hard time right now. Is there anything you want to talk about? Right. So they can encourage you to talk, to have an opportunity to give you a space for reflection and expression. They can distract you, right? If they see that you're picking, they don't have to interrupt it. They can just say, "Oh, hey, do you mind helping me with this over here for a minute?" Right? I really like that strategy because it's really subtle, and it interrupts and it gets you up and moving, and forces you to take a break, without actually saying, "Hey, I see you're picking." Right? So that's one of my favorite ways. Um, you can also have code words. I like code words around the house. Make it silly. So that's like a realization. Oh, okay, yeah. So you don't have to, just to help you to bring awareness when you're picking, right? A person will say a code word. Having reminder post-it notes around, or words of like that are encouraging, are great. It's actually really nice. I mean, you can write your own. I love it when you write your own, but I also like it when like the family or people in the household get involved and write you little like notes too. Like, you got it today, or, looking good. Um, I'm here for you, whatever little notes for you. And that might make you smile. And I like that. Oh, and also just like engaging you in an activity. Hey, I'm thinking about going on a walk. Want to come? Um, oh boy, I am feeling really tight right now. I'm going to stretch. Would you like to join me? Okay, so that's other subtle ways. I love that method as well, to get you involved in something else, if they're noticing you're picking. These are all great ways to address that feeling of shame, and to prevent you from feeling embarrassed and feeling supported. Okay. Um, okay. Wow, it is 1 o'clock on the dot, and I went through all the questions. Are there any other last minute questions that I can help you with today? And if another question comes up and we're done, feel free to email support@skinpick.com for other questions, or join us next time. Let's see, this is March. Next session will probably be in May. Keep an eye out. We do it about every other month. Yeah, so keep an eye out for our next session. Rewatch the video on YouTube if you'd like. Share the video on YouTube if you'd like, if other people have questions. And we are here for you. And thank you. I'm going to close this box up. Nothing else is popping up. So thank you all so much for coming and joining today. Take care. Have a good weekend. And use those fidgets. Stay strong. We're here for you. And I'm going to stop.